Americans are living longer than ever, and if we are prepared for the future, we can lessen the burden on our family and ensure that we are receiving optimal care. The preparation process can be a daunting task and requires careful consideration for all parties involved. If you are not currently going through this, it's almost certain you know someone who is. Throughout this series, you will get the tools to best support your aging family members and their caregivers with compassion and dignity, all while empowering them to make the best choices. When given a diagnosis that is life-limiting, whether it is 2 years or 2 months, the news can be overwhelming for the entire family. Luckily, there are many ways to help make the entire family feel comfortable and supported through this difficult time. Choosing which option is right for your family requires a bit of research, and in this segment, we'll explain the different resources to help make your search easier through this stressful time.
How are you feeling, Dad? Are you in any kind of pain? Do you need more medication?
No, I'm okay, Susan. And I want to thank Jack for getting the hospice person even before Dr. Moore ordered it. That was a big help. How are you doing?
Dad, why are you even concerned about me? With all you've been through with the chemo and the surgeries and the hospital stays, doctor's visits, I'm just glad that you can be in your own place with your own stuff and really kind people to help take care of you. I'm sure a lot of the other options would have been fine too, but it's nice to know you're in your own home.
No, I'm very thankful that I am here, that I can be with your mother, even though we can't communicate any longer. I don't know what I would have done if I wasn't beside her.
Well, we will take care of her, and we will work with the hospice team too.
Being the caregiver may seem at times very stressful and isolating. Here are some tips to use in order to maintain a healthy frame of mind. When topics become uncomfortable to discuss, try to maintain respect. You will feel better about the conversation when you look back at it, knowing you remained calm and did not get defensive. If you're having a hard time getting your point across, try to remind your loved ones how much you care for them. Be sensitive to your parent or spouse's dilemma. Allow them the chance to breathe and make mistakes, especially when topics like depression, anxiety, or confusion come into play. Remember that not every person is in touch with their emotions. Make sure that you take time for yourself and breathe. You should turn to friends or other family members to talk about what's going on and have a shoulder to lean on if things start to feel overwhelming. Live in the moment and embrace life for how it is. Some things are just out of our control, so accepting that can help make sense of the unknown. Accept the help that hospice can provide. It allows caregivers to become family members once again and allows for a better connection between themselves and their elderly family member. Don't let your biggest regret be that you didn't have hospice services sooner. Hospice care is delivered by an integrated care team of specially trained physicians, nurses, certified nursing assistants, social workers, chaplains, and volunteers who all work together to meet the individual needs of each patient and family. Hospice also includes grief support by trained licensed social workers. The best place to start is both the National Hospice and Palliative Care Organization and the American Hospice Foundation. You'll find suggested questions to evaluate quality of care and help you make an informed assessment when choosing a hospice. Costs for all patient care, supplies, and medications related to the life-limiting hospice diagnosis are covered by hospice. There is generally no cost to the patient. This coverage includes some medications and medical equipment like wheelchairs, hospital beds, and walkers. If you are over 65, your hospice services are paid in full 100% by Medicare, the federal insurance program. Other insurance programs also have hospice benefits that mirror the Medicare benefit. Most patients will not be turned away due to the lack of insurance or inability to pay. Check out the NVCC website to see our members who provide these services.